had chemical evidence of recurrent disease as indicated by an elevated carcinoembryonic antigen level. He was found to have a recurrent lesion in his liver, which was non-surgical. Mr. Rolls has been completely stable for over 1 year without any form of intervention. He has not been hospitalized nor had any medications directed towards any form of treatment of this disease. Mr. Rolls remains in excellent and good health. He continues routine follow-up with this clinic. Yours sincerely, signed by Dr. Henry Gallo. And I wanted to share that with you because this gentleman is so excited, and he comes into our office very, very often, and he speaks to as many people as he possibly can and loves to share his experience with anyone that'll listen.
I hope he stays off that aflatoxin. That's probably what saved him. It's one thing to kill your parasites and stay off isopropyl alcohol, but staying off aflatoxin is quite a challenge by itself, and it would only take 1 or 2 good-sized doses to do that liver in. So I'm hoping for it.
14 months ago, I was diagnosed as having cancer, bone cancer, metastasized to various parts of my skeleton. And even after several weeks of exhaustive tests, no primary source was ever confirmed. In October of '94, I had 5 radiation treatments, followed by 6 weeks of chemotherapy, that is Monday to Friday, every 5th week to alleviate the terrible pain. During last winter, I was also on a heavy dose of pain medication every 4 hours around the clock. Finally, in January of this year, I started into alternative treatments, in addition to those prescribed by the oncology department. In April, while working on 2 helpful programs, a friend of ours passed on to us photocopies of the first 10 pages of Dr. Clark's book, The Cure for All Cancers. It sounded so credible, so convincing. Her compassion for the suffering and the urgency to get help to the consumer could be felt in her writings. And then there was the name. What's in a name, you say? To me, the name, Hulda Clark, spelled integrity, trust, confidence, and responsibility. I believe you know what I mean. Paramount to this was the support we had from family, friends, and our church community as we prayed for discernment for treatment and healing. My experience is an answer to those prayers. In May '95, my husband and I began the parasite program. In June, we decided to follow through with restorative dental work. Fortunately, our dentist was receptive to the idea, having read Dr. Clark's book. So within a month, all of the amalgam in my teeth was replaced with composite fillings. The search for cavitations or pockets was never discussed. At this point, we felt we had reached a stalemate, and if we were going to follow through on the cleanup, we needed to see Dr. Clark, which we did. Her testing revealed freon, copper, wood alcohol, aflatoxin, cobalt, some parasites left in the duodenum, staph infection in my jawbone, E. coli on the bone, and Shigella on the bone. Each required special treatment. To remove the copper, I received chelation therapy, a total of 6 500cc bottles of intravenous over a period of 3 days, containing EDTA, clodronate, vitamin C, and procaine. The next day I tested negative for copper. For the freon, I drank 3 glasses of ozonated water each day, still do. And herbal tea as kidney liver cleanse helps the liver detoxify and helps the kidney eliminate toxins from the body. The wood alcohol was found in some of my medications, and eliminating them solved that problem. For aflatoxin, I had to be very careful that I avoided moldy food. And then, as Dr. Clark recommends, vitamin C in cooking, especially for grains such as rice and oatmeal. Since cobalt is present in laundry and dish detergent, I had already changed to borax and washing soda at home. But now, since we were staying at a friend's home, it showed up in my testing. And so we decided to wash the linens we were using with our own soap. And my dishes were kept separate from those washed in the dishwasher. And then the parasite problem. After 4 months on the parasite program, one stage of the parasite was still left in the duodenum. A series of cleansing enemas and another 4 containing some tincture of black walnut finally resulted in a negative test for all the stages of the intestinal fluke. I saw a dentist in Tijuana for consultation regarding the positive test for staph on the bone. And would you believe it? An x-ray of the jaw revealed 4 cavitations at the site of the 4 wisdom teeth extracted approximately 28 years ago. This infection was drilled out of the bone. Can you feel the dentist's drill? Followed by very strict mouth care. The next day, Dr. Clark tested me for staph, and it was negative. And then there was E. coli on the bone, which was treated with rhodozonic acid for 2 days. And the next day, I was negative. And then I had Shigella on the bone. And then I was put on the bowel program consisting of concentrated tincture of black walnut, fennel, turmeric, sodium alginate, and Lugol's iodine. The most exciting, rewarding, and exhilarating experience came at my final appointment with Dr. Clark. All tests were negative. Presently, I am still on the bowel program, and I'm continuing with the kidney cleanse tea and daily zapping. I have done 2 liver cleanses in the past 3.5 weeks since returning from Mexico. In fact, we just returned a month ago. And the 2 liver cleanses have resulted in digestive patterns and bowel movements approaching normal after 15 years of gastric discomfort and irregular so-called fast bowel patterns. What a relief. I'm continuing with the 12 various minerals, vitamins, and teas for bone building, as prescribed by Dr. Clark, for another 4 months. She figures after 10 weeks on the bone building program that there should be a decided or noticeable difference in the bone scan. An abdominal ultrasound 3.5 weeks ago showed no change in 2 questionable areas the doctor was monitoring over the past year, nor was there any further spread of the disease. My oncologist was very encouraging when I visited him this week and suggested I carry on with whatever I was doing. I figured it wouldn't hurt. Until my next visit in February '96. And then a follow-up bone scan will be done prior to that visit, and we hope and pray that it will reveal an improvement in the bone density as a result of the bone building medication. That's why I asked to have it in January or February, so you can help pray with me that the doctor will really notice a difference. In spite of some definite improvements, I'm not out of the woods yet. A mysterious pain continues to linger in my right hip and lower back. Is it caused by further toxins? Is there disturbance in an original tumor in the head of the femur? Is the nerve irritation from the compression fracture in the lower thoracic vertebrae causing referred pain? Unfortunately, Tijuana is too far away for regular monitoring, but Dr. Clark's books will continue to give direction in eliminating parasites and pollutants from our lifestyle. Since bone restoration is a slow process, it will inevitably take a long time, perhaps years, to eliminate the remaining symptoms and allow the body to return to wholeness.